So we'll be talking about the triple burden of malnutrition from a number of different angles today. So in this session, we will cover, first of all, the overview, and I'll give some highlights from the global survey of school meal programs that GCNF conducted last year. We will have a presentation on UN nutrition and how school meal programs fit with the goals of UN nutrition to reduce malnutrition. And Stinike Lenema will present that. She is the Executive Secretary at UN Nutrition. We will be addressing the question of overweight and obesity in low and middle income countries. This is a neglected issue that we've decided is important for us all to discuss. And Jenny Davis, a postdoctoral scholar and registered dietitian and nutritionist at the Institute for Global Nutrition at the University of California, Davis, will speak to that issue. We had hoped to have with us today Bibi Gayose from the African Union Development Agency, NEPAD. She's been unable to make it, but we still hope to touch a bit on some of the key actions in Africa addressing nutrition. This is Africa Year of Nutrition, and there are a number of activities going on that are really important to that effort. And then we will have some time for questions and answers. So I'll start with a brief overview about why nutrition is important. We all talk about nutrition, but we sometimes forget just how important nutrition is to society. The current state of nutrition is not very good. Our diets are harming our health and the planet. Our diets aren't healthy. We're not eating enough fruits, vegetables, legumes, and nuts. We're eating too much red meat and processed meat. In fact, 5 times what is recommended. We are drinking too many sugared beverages. And no region in the world is meeting the recommendations for meeting the SDGs. Low-income countries have the lowest healthy diet rates of intake of healthy diets, and the highest numbers of underweight. High-income countries, such as my own, have the highest intake of unhealthy food, and our impact on the environment is very, very dangerous. We are highest in high-income countries in rates of overweight and obesity. So diet-related disease and mortality is very high. The rates are very high, and they're growing. We're not doing better, we're doing worse in most cases. Over 1/4 of all adult deaths in the world are linked to poor diets and nutrition. No region is on track for reducing premature death from non-communicable disease by 2030, which is the SDG target. Our diets are horrible for the environment. 35% of all greenhouse gas emissions are related to food and food production. So there's a lot of work to be done. It's a serious state. This is all the data I just gave came from the 2021 Global Nutrition Report, and it is very dire in consequences. And I think we all know that the COVID-19 pandemic has raised even more issues about the relationship between our diets and our health. I want to give a very simple overview of what we are calling the triple burden. This is a WHO depiction of triple burden. There are many ways to describe malnutrition, challenges, but this is one that I think is very simple to see. There's issues of underweight, which means wasting and stunting. You see on the left in blue. There are conditions of micronutrient deficiencies, which is the purple listing of vitamins and minerals that are needed for healthy growth. And then there is the issue of overweight and obesity on the right. Those are the conditions that kind of set the stage for malnutrition and the challenges we face, and we'll be talking more about those as we go forward. Now we turn to the Global Survey of School Meal Programs, and I'll give you some highlights from that. The 2021 Global Survey is the second survey that we've conducted. The first was done in 2019 and focused primarily on the 2017-18 school year. The second survey that I'll be focusing on today covered the 2020 school year, which, as you know, was the school year completely affected by COVID all over the world. The survey is very comprehensive in nature. We mentioned that yesterday. It's very extensive, about 40 pages of questionnaires covering all aspects of school meal programs and linkages to agriculture, health, economy, job creation, etc. There are questions that come from the national level of policies and program information, and then there are many questions devoted just by program descriptions of what's happening with school meals. We are extremely grateful for some of the financial support for carrying out the survey to the U.S. Department of Agriculture and the Global and the McGovern-Dole program for providing funding. Reports of the survey are available from GCNF, and I'll give you website links, et cetera, in a bit. So between the two surveys that we conducted, 154 countries have been involved. Some of them did the survey, both surveys, and some just did one survey. But together, that covers about 81% of the world's population. So we think it's a very good picture of what's happening with school meal programs around the world. Give you just a few highlights. First of all, the questions relevant to nutrition are many, and they're scattered throughout the survey. So, for example, we ask about countries' laws, policies, and standards related to nutrition in school meal programs. We ask about food basket. We ask about fortification. We ask about training of cooks, and a whole set of other questions. And then on the right-hand side are some of the complementary activities that we ask about in the survey as well, including things like hand washing with soap, clean water or water treatment at schools, physical education, nutrition and food education, etc. So now to some of the results of relevance to nutrition. At the national level, 72% of all countries reported having national policies, laws, or standards related to nutrition in their school meal program. We all know that having a law or policy or standard doesn't necessarily mean it's being implemented, but it's a very good start to knowing that there's some priority being given to nutrition by national governments. At the program level, we can see that 93% of all programs report that they have health and nutrition objectives. Only 35%, however, have an objective to address or mitigate obesity. 63% of the programs report that they involve nutritionists in their program. 40% say that they train cooks in nutrition. And 87% say that they provide food and nutrition education. When it comes to food basket and beverages provided to students, these are the categories of food items that we include. We put them in fairly large food groupings, such as such as grains and cereals, roots and tubers, legume pulses and nuts, dairy products, etc. on the food side. And on the beverage side, we basically ask about drinks and whether they're sweetened or unsweetened. So when we look at the food basket diversity across programs, and we took out salt and oil from this equation, the top part of this depicts the region of the world where the results were, and the bottom part is the economic level of the countries that were included in the survey. So same question, but split by geographical region or by income grouping. So the top part shows that the least diversity in school meal food baskets are in sub-Saharan Africa, Middle East, and North Africa. They have the least diversity in their food baskets. The bottom part shows that by income grouping, food baskets in low-income and middle-income countries are the least diverse. To dig into that a little bit more, just to give an illustration, just about 23% of low-income countries and almost eat fruit or serve fruits in their school meal program, and almost 100% of high-income countries or programs in high-income countries provide fruits. And in the case of poultry, 5% of low-income country programs reported serving poultry, and 69% in high-income countries. If you look at the graph on the bottom left, it indicates that unsweetened milk is the single most served beverage in school meal programs. We ask about fortification, and fortification gets to be a little bit tricky because much of the donated food in the world is fortified. It comes as corn-soy blend or fortified corn-soy blend, for example. So when we ask about fortification, many low-income countries actually report using fortified products because they're using these donated fortified products. But overall, 51% of programs report using fortified food. 5%, only 5% are using biofortified foods such as orange flesh, sweet potato, or iron-rich beans, for example. 16% of the programs report using micronutrient supplements of some type. And again, these statistics are a little bit skewed by the corn-soy blend domination in many low-income countries. But in fact, the top five most common fortificants are vitamin A, iodine, iron, vitamin D, and zinc, all critical micronutrients for child growth. This slide is about training provided to cooks or caterers. About 60% of programs say they train their cooks in food safety and hygiene. Slightly less than half say that they train their cooks in nutrition. About 40% say that they train cooks in menu planning and measurements. And very, very few programs report training cooks in business skills, which could be important for good management of the food service. The cooks are overwhelmingly women. 82% of the programs said that at least 3/4, if not more, of their cooks are female. And 1/3 of those said that less than half of their cooks are paid. So a very large portion of volunteer cooks or very low-paid cooks. And where the portion of women is the highest in the cook category, the lowest payments, lowest level of payments to cooks are reported. Infrastructure is also important to school meal programs, and I realize you won't be able to see all of this, but we basically ask about the infrastructure available at school level, and the categories were electricity. I'm reading down in the order on the left column: electricity, clean water, piped water, flush toilets, kitchen, and dedicated eating spaces or cafeterias. And you can see the reporting, again, by income type, income level of the country. Low-income countries score the lowest on nearly every one of the infrastructure questions. So that wraps up some of the highlights I'm reporting today. There's a lot of additional data. And if you want to find out more in terms of survey results, in your packets you should have gotten a country report or a country summary. It may or may not match your country, but it will look like this. The left-hand piece is the page 1 of a country report. Basically what we've done is taken the highlights of a survey from each country and summarized it in a 3 or 4 page document. So the first page covers everything from financing and policies and coverage rates, food baskets. The second page, which is the right side here, covers some of these key nutrition interventions. It covers employment and focus on gender and agriculture. And it talks about successes and challenges. And the next page or 2 will be summaries by program in the country. Each program has a short profile that gives you a quick summary of what the program in the country consists of. The full reports of both surveys, the 2019 and the 2021 surveys, are available. We have some examples in the marketplace you can have a look at. And you can also download them from our website. We also have 2021 executive summaries available in 6 languages, and we have social media tools and infographics also available on our website. So that's it for my presentation. I want to thank you. I hope you found it interesting, and I hope you will take a closer look at the survey results for your own country, for your region, and for the global picture of school meal programs. And with that, I would like to move to the next presentation, which will be from Stineke. Stineke Wanema is the Executive Secretary for UN Nutrition, and many of you may know her also from her role in the UN SCN, the Standing Committee on Nutrition, which has morphed into UN Nutrition, and she'll tell us more about that. So please welcome Stineke to the mic.
So good morning to all, and thank you for the very kind introductions. My name indeed is Stineke Unema. I am very happy to be here. And yes, some of you may have seen me in my former role as coordinator of the UN System Standing Committee on Nutrition. I believe that I was with you in 2017. And since then, I think what I've seen from a bit of a distance is that the momentum for school food and nutrition and school meals programs has grown a lot. So I'm very happy to be here with you again and say a bit about what is UN Nutrition and how that fits with your work. Before I go into my actual presentation, I just want to share with you my impression of yesterday. And I just want to share that even though I have spoken with only a few people and I've seen only a few presentations so far, it struck me. All of you had a smile on your face. It struck me, the energy when you spoke about your projects, your programming, your work, whatever you are doing. And I believe that is what keeps this group together, and that is what makes this group different from so many of the other meetings, conferences I am in. This is really concrete work. This is energy. This makes a difference. This shifts a needle. So again, very pleased to be with you. So UN Nutrition, as Arlene already mentioned, we evolved from the merger between the UN System Standing Committee and the UN Network for Scaling Up Nutrition movement. So there was a little bit of a, well, let's not say a chaos, but nutrition world in the UN was a bit overwhelming. We had 2 coordinating mechanisms for nutrition, and that doesn't make sense. So hence, the 2 were merged and became UN Nutrition. One thing you should remember, though, is that UN Nutrition is not a new agency. You could rather see it as a committee, and it works with the members. We have listed them there. It's about 15 members, and the founding ones are WHO, FAO, UNICEF, World Food Programme, and World Health Organization. You can imagine these agencies have a huge mandate in nutrition, and therefore they are called the founding agencies. A difference, though, with where we came from, with both UNSC and the UN Network for Sun, is that we have invited 2 more agencies to become part of the steering committee, IAEA and UN Environment, also to show even better the multi-sectoral character of nutrition. It's, of course, it's with food and agriculture, FAO, it's with health, WHO, etc. But also UN Environment has a huge role to play. As Arlene pointed out, we face huge environmental problems, and our diets make part of that problem and also part of the solution. Let's keep that smile on our face. So beyond the steering committee, we have about 15 agencies. Some of them are very active, some of them are less active, but then they pop up when we address a certain topic that is close to their heart. Okay, so we did a strategy, obviously, because UN Nutrition is new, so we took a bit of time since 2020 to develop a strategy, and that's basically it. A vision, of course, a world without malnutrition, all forms of malnutrition. But that's not just it. The vision is a bit broader. I didn't want to use all the words. It really emphasizes human rights. Everyone has a right to adequate food, and all other human rights are interrelated, and that's part of our vision. It also closely links to the SDG, the 2030 Agenda. But the mission of UN Nutrition, underpinning it all, and again, it's not an agency, is to bring all the UN agencies together to tackle malnutrition in a consistent way, also along with its root causes. So, objectives. On the one hand, it's coherency, coherent policies, approaches. On the other hand, it's consistent activities, actions on the ground. And the 2 cannot go without each other. I'll get back into that a little bit later on. In the middle, you see the 3 bubbles, and that really shows that the togetherness is so important to us. One, it's the action, the support to governments at all levels, from global to regional to local level. The UN is there to support governments. Then the collective knowledge management. I pointed out the policy coherence, the coherent approaches. You cannot do that if you do not have knowledge management that is up to date. So that's quite central to our work. And then finally, but not least, it's the joint communication, the one UN voice for nutrition. It doesn't help if the voices are scattered. We need to keep nutrition on that global agenda, on that national agenda, and we have to do that as one UN for nutrition. So the challenges are huge. Arlene pointed them out. So we have identified as committee, as collective, as UN Nutrition, a few priorities to focus on in the coming years. One is healthy diets from sustainable food systems. Arlene pointed out the huge environmental problems and the challenge at the same time to make sure that people have access to a healthy diet. Those 2 should come together. So we work a lot on that. And as we speak, we are finalizing a discussion paper that links nutrition with the triple planetary crisis, the climate change, biodiversity loss, and pollution. So that's one. Another one is the private sector engagement. Also in school meals, everywhere in nutrition, we all work with the private sector, and that's for better nutrition. However, there's also sometimes issues with engagement with the private sector. And all agencies so far have their own due diligence policies, their own ways and their own objectives to engage with private sector. And we now want to bring that together for joint criteria to work with the private sector. And that would also help the community, nutrition community beyond the UN. Then fragile contexts. Climate change, wars, conflicts don't help. So nutrition in fragile contexts becomes more important ever and ever. But we cannot focus only on the emergency and the fragile situations. While addressing these issues, at the same time, we need to look at system change to prevent that the situation further deteriorates and also to prevent, hopefully, future crises. And then finally, the World Health Assembly targets. We are not there. By 2025, we are supposed to achieve a list of World Health Assembly targets, but we are not there yet, close. So we said, okay, let's accelerate that coordination and make that happen at country level. And if Bibi would have been here, the African Year of Food and Nutrition Security is also focusing on those targets. Okay, so what do? We act as one, as mentioned. We provide strategic support to country governments, and it's also here that we work closely with the Scaling Up Nutrition movement. There is a global support system, as we call it, and together with NGOs, with UN agencies, with private sector, we support the Scaling Up Nutrition movement countries to achieve their nutrition targets. The speaking as one, we can split it in two, in communication and advocacy. The advocacy I already mentioned, but the communication is hugely important. Whenever we know something, we need to communicate about it. People should be able to benefit from it. So in that sense, we are also, we're sending out newsletters. We do a lot on social media. We are building a new website, and that will all serve that communication, which is so hugely important. And then finally, I put there learning as one. You could say maybe sharing as one, sharing knowledge. You could say thinking as one, but then I said, okay, let's stick to the learning as one. And I mentioned already the example of what is it exactly? How does nutrition link with environmental issues? So that's one of the learning as one we do. But we also do discussion papers about aquatic food, for example, last year. It's kind of a forgotten topic, whereas it could contribute so much to better nutrition. So we really try to list, collect, bring together that knowledge, and then make it available to the wider community. Okay, so you may have questioned yourself already, where are the kids? Where are the schools? Why is she here? And indeed, school meals is not listed among our priorities, but it is very much related. The facts are there. School-age children and adolescents, they face multiple burdens of malnutrition. They are not exempt. They are malnourished, even when they come to school already. When you flip that around, healthy and well-nourished children, they grow up healthy, but also they grow up to become maybe more productive adults. So it's a two-way, it's a double-duty action, as to say. If your children are healthy, well-being will increase, but even your economic growth will be better. And then also, if you make it smaller, schools provide a platform for early adoption of healthy food practices. And those healthy food practices could also be sustainable. So I'd like to go to that right side, actions. And I'd like to start from small projects to bigger system change. Nutrition education and school feeding. It helps to establish lifelong dietary choices for children, and it helps to feed the children even that particular day. We have seen if we don't do it following COVID pandemic, you've really faced this backdrop. So it helps. If you make it a little bit bigger and you look at the type of school feeding program, and you look at homegrown school feeding program, it offers a huge potential. That one can work as a lever to increase the collaboration and to increase the involvement of an entire community to shift production practices that favor human and planetary health, but also improve local economy. And then if you go a little bit beyond and look at, okay, homegrown school feeding, what if we could, mobilize public procurement in support of homegrown school feeding? That would help shift the entire systems, because the farmers, the community will have a certain supply, certain demand, so they can plan better and they can shift their production systems for the better. So, you can make it from small, a nucleus, a very valuable nucleus, to a bigger one, a program, and then a system change. So that's why I'm so happy to be in this room with you. Just summarizing again, UN nutrition, rights, human right to food, other human rights, multi-sectoral, multi-stakeholder, and look at the comprehensiveness of the school policies and the school activities, involving everyone, as pointed out by Arlene as well. But government leadership is essential, and I've heard many of you saying that before me, and I see so many government officials in the room. So again, very pleased to be with you. So what's next, moving forward? UN Nutrition hosts this community of practice on school food and nutrition. It gathers several of the UN agencies and really makes sure that we are all aware what is happening in this area, and it also makes sure that we share knowledge, information, so that other actors can take advantage. I made a mistake. I said UN agencies, but it's beyond the UN agencies. We also have the GCNF, we also have other NGOs, and we have some academia. So it's really a vibrant platform that makes sure that what one knows is available to the others. Very practical also, we did an interesting inventory of all kinds of school food and nutrition practices and policies, and we are identifying where are the gaps and how can we fill the gaps. And it happens then that, for example, FAO and UNICEF will then do a project to cover that gap, or maybe FAO and WFP, to see how we can fill that gap, but then immediately through that COP brings it back to the wider community, to the benefit and information of all of us, all of you. So in our communication, so that's more the action and action learning, I should say. But we also continue to promote and advocate for school food and nutrition, simply because it is a lever to transform diet for human and planetary health. So it's so much in support of one of these priorities I just mentioned, the healthy diet from sustainable food systems. I already mentioned the need for for system transformation. So that shifting the needle aspect, we use these kind of examples in our communication, not just to promote and advocate for nutrition, but also to advocate for system change. And then finally, the acceleration of the achievement of the World Health Assembly targets, because that's part of our vision, zero malnutrition for all, leaving no one behind. Thank you so much.
Next, we want to move to obesity and overweight, or overweight and obesity, a topic that many of us in this room don't pay enough attention to because we've been so focused on hunger and undernutrition. But we do have an expert with us today to talk a bit about a recent new study on overweight and obesity in low and middle income countries. And that is Jenny Davis, postdoctoral scholar and registered dietitian and nutritionist at the Institute for Global Nutrition at the University of California, Davis. Jenny, please join us at the microphone. Thank you.
Hi. I haven't spoken in front of this many people in years, so this is an honor to be here, and I'm also really excited to share information with you about a subject I find incredibly important and very fascinating. As Arlene mentioned, I'm a global nutrition researcher at the University of California in Davis, and I've been studying the double and triple burden of malnutrition for a number of years now, as well as various ways to assess the contributing factors. So I'll go into a little bit more detail about that and then move into the study that Arlene mentioned. So we've already been talking about what is this triple burden of malnutrition, and just to point it out again, we've got 3 different areas of malnutrition. So we've got underweight, wasting and stunting, micronutrient deficiencies and anemias, overweight, obesity, and non-communicable diseases. And I think what's also really important to understand is the different levels that these burdens of malnutrition can exist on. So you can have them at an individual level, so within one person. You could have them in a household, so maybe a child with stunting and a mother with overweight or obesity. You can have them within a population where you have any number of burdens of malnutrition. And you can also have them over the course of one's life. And so when we think about that, we can think about potentially a child with anemia or with micronutrient deficiencies, and later growing up to be an adult with maybe diabetes or another non-communicable disease. And when we think about it, particularly at this population level or over the course of one's life, we can really think about how there's this multi-burden of malnutrition, because it's really not restricted to having 1, 2, or 3 forms. You can have a multitude existing at one time, or certainly over the course of one's life. So we've definitely, as a nutrition and health and education and entire global community, we've been paying attention to stunting and wasting and underweight for a long time, and we must continue to do so. But we've definitely been paying less attention to micronutrient deficiencies and also overweight and obesity. And this report just came out a couple weeks ago. It was published in the Lancet, and it's the most recent estimates of micronutrient deficiencies in the world. And these authors found out, or what they are reporting, is that 50% of children who are under 5 years of age and 2/3 of all adult women in the world have at least one micronutrient deficiency. And so if we think about it in that context, we can really see that micronutrient deficiencies are this under-addressed nutrition priority. And then thinking about overweight and obesity, about 45% of all adults and about 20% of children have overweight or obesity in the world. And within those percentages, the vast majority, about 70%, are residing in low and middle income countries. So really, overweight and obesity, it's no longer confined to a high income or upper middle income country or even upper income populations. And in fact, the greatest rises in prevalence of overweight and obesity has been occurring in rural areas of the world, and particularly in Southeast Asia, North Africa, and Latin America. So if we pair these numbers with what we just saw about the prevalence of micronutrient deficiencies among young children and adult women, it's pretty obvious how we can have this triple burden of malnutrition existing on a global level. And because we have a great prevalence of overweight and obesity, the cost of treating obesity is quite high, and this is across the world. There are very few economic analyses of what it costs in low and middle income countries, but this report came out in 2021. And it included India as a lower middle income country. And in this report, what they found is that the cost of treating obesity, and this is medical costs as well as the indirect costs, so like costs for transportation, cost of caregivers to take care of their loved ones, it's about, on average, 2% of the gross domestic product, or GDP, across these 8 countries. And thinking about the increasing prevalence of overweight and obesity in this study, they looked at 2019 to 2060, that increase is set to rise across all countries in the cost to treat it. And for example, in India, that cost is set to rise 19-fold if we stay at our current conditions. So this is definitely a significant problem. So why are we seeing so many micronutrient deficiencies and this increasing prevalence of overweight and obesity? And quite simply, it's because our dietary patterns are changing. Non-nutritious calories are becoming cheaper and more accessible, and nutritious foods are getting more expensive and less accessible. And we can definitely see that right now with rising costs of living, particularly, and rising costs of food, particularly among our energy-dense and nutrient-dense foods like meats or animal source food products. And with our with our dietary patterns changing, it's because our food systems are also changing. And I know this is a little hard to see, so I'll walk you through it a little bit, but I think this graph really helps show what's going on in the world. So this is from the 2018 Global Nutrition Report, and it's looking at trends and patterns per capita in packaged food sales. So if we look at these first three columns, this is North America, Europe, and Oceania. They've been purchasing large volumes of packaged foods for a long time. It's been going on, and they still have a very high, they're purchasing a lot of packaged foods. But we also see a very high volume in Asia and a steep increase in Africa. And this is from 2005 to 2017. And so what I see here and what this means is that packaged foods are really making their ways into our normal dietary patterns. And when we see these packaged foods moving into just regular dietary patterns, there's this unfortunate opportunity for these foods to be displacing more nutritive foods, more traditional foods, and that's certainly happening around the world. And I think a good example of this comes from a study that was done in 2019 in Nepal, and this was from Helen Keller International's ARCH project. And they found that among young children, and these were quite young children up to 28 months, these children who were high consumers of unhealthy packaged foods and sugary beverages, and high consumers meant they were taking in about 50% of their daily calories from these foods, that these children were at greater risk for micronutrient deficiencies and greater risk for poor linear growth than their counterparts who were eating less of these foods and beverages. So this was a cross-sectional study, so we can't say one causes the other, but what it does is it provides some evidence that these dietary patterns that are really incorporating packaged foods could potentially be resulting in micronutrient deficiencies and stunting. So it's definitely something to be paying attention to. And I want to give, I'm a researcher, so I wanted to give a little bit of a biological example also of how a condition of undernutrition can potentially lead to these conditions of overnutrition. So if we think about a woman who is pregnant and she is underweight and has micronutrient deficiencies, which we know can be very common, it's also very likely that the child that's developing inside of her is also undernourished. And when a developing child is lacking, and when a developing fetus is lacking in key nutrients like iron and B12 and folate, what can happen is we can have these structural and physical changes to organs as they're developing. And when this happens, there's a metabolic dysregulation that can result. And by metabolic dysregulation, I mean there's this potential to develop insulin resistance or hypertension later in life, potentially leading to diabetes or heart disease. And this certainly doesn't mean that all children who are born to underweight mothers are going to have diabetes or heart disease. But if you have children who are born such as this, and they're born then into an environment that's replete with non-nutritious calories and lots of unhealthy foods, this epigenetic predisposition to heart disease or diabetes can surface. So what I've kind of been trying to point out is that there's a number of shared drivers between undernutrition and overnutrition. And these drivers, these causes, all work in tandem as a system to either cause or prevent undernutrition and overnutrition. And I think it's really important to think about this as a system, because one of the big misconceptions that I hear about with obesity, for example, is that obesity is the problem of an individual, that it's an individual's fault that they chose to eat too much, or it's an individual's fault that they have decided to be sedentary. But we don't apply that same logic to those who are underweight. For example, an underweight child or an underweight adult. We don't say to these people, it's your fault that you have too little to eat. So when we think about it, it's really the environment that's really influencing our conditions of undernutrition and overnutrition. And our environments can influence our biology. They can influence our behaviors and our demographics. And I think as a group here, especially as we have a number of health professionals and educators, we can really work on this food environment, and school feeding is definitely a really good example to think about how to better it to address all forms of malnutrition. And I'm not going to go into a lot of the drivers and the various interventions here, and so that is something that I'll be talking about when I help lead a workshop later on today. So if you're interested in thinking more about how to come up with interventions to do this, we'll be working on that in the workshop today and then also tomorrow. So what I want to go into now is what Arlene mentioned, is that this report that I helped produce earlier this year, this was in connection with Core Group, and they wanted to provide a resource to non-governmental organizations and program implementers on how to address overweight and obesity in low and middle income countries. So I helped them put together this report. It's freely available on their website, and I'm happy to lead anybody there if you would like. So to put together this report, I conducted a consultative inquiry. So I did a bunch of interviews with nutrition, health, and policy experts from around the world. I talked with researchers and government ministers. I spoke with people who work within NGOs and people who fund NGOs. I spoke with a lot of representatives from the organizations that are here today and in this conference. And in total, I conducted about 29 interviews, and we talked all about how to address overweight and obesity in low and middle income countries, but primarily about what role NGOs and program implementers can play when they're already there to address various forms of malnutrition. And just to give a little overview, these are the different countries and different areas of expertise. So I spoke with about 16 people from low and middle income countries or working within those countries, and then also a number of people from upper middle income and high income. And that's mainly because all the evidence we have on how to intervene in particular in overweight and obesity is coming from these upper middle income country contexts. So, which definitely underscores how we need more information from low and middle income countries. And there was 4 roles that primarily emerged from these conversations. And in the 4 roles, everybody was emphasizing this need for multi-sectoral collaboration. And in the first role, this is nutrition programming, strategies, and policies. What was brought up in the interviews was really how programs, policies, and funding that are already in place in our various contexts are already set up to address overnutrition while they're addressing undernutrition. We just have to really think about it and emphasize how these programs and policies can do that. Under advocacy and stakeholder engagement, which was the second role, clearly we have all learned to be advocates and engage people as much as we can, but we can also kind of direct this energy towards also addressing overweight and obesity. One of the big things that came out of these interviews was that a big barrier to being able to develop a program or being able to get funding was that there's a lack of interest in addressing overweight and obesity. And sometimes lack of interest can come from not knowing what causes it, or also not even being aware that it's a problem within a given community or a country. So by being advocates and engaging key stakeholders, we can help to liaise and make these connections between those that need our help and those that are available to actually do the helping. And as NGOs and program implementers, that was one of the roles that came out as being important. Again, I've already said this, and it's also because I'm a researcher, but there is far too little data on overweight and obesity in low and middle income countries, and even more so on interventions. So we really could use more partnerships with research organizations, between organizations who may not know how to do the research on their own, to be able to collect this data, collect this information, because that's often what governments, funders, and many organizations need in order to make these programs and form these policies. And finally, technical support. NGOs and program implementers have a huge amount of experience and expertise all over the world, so really leveraging this to redirect conversations towards overweight and obesity, in including it with underweight and undernutrition. Nothing needs to be left out, but we can certainly add. And then finally, I just wanted to give a quick example of how school feeding programs can address undernutrition and overnutrition, and we've already talked about this a bit. They're also a great example of how it can encompass all those 4 roles that I was just talking about. And this example actually came from my interview with Arlene when I spoke with her. So if we have any questions, we can talk to Arlene. But within a school feeding program, our goal is to get nutritious foods to children at regular intervals so that they can grow and they can develop as they should be able to. And as I was just saying, if we can get children to be healthy when they're younger, they are much more likely to grow into healthy adults. So with the school feeding program, if we can connect it to local commodities and local farmers, we can be using local foods and creating interest in the local environment, which also can create those strong economic links within their own communities. If the program can be developed with parents and communities, we can get their buy-in, we can get their interest, their awareness that we have both undernutrition and overnutrition to be thinking about. And if we can also implement nutrition education in the classrooms, the children can take more interest in what they're eating, what they're learning, connect their food to their bodies, connect it to their environment, which will ultimately help garner that interest and awareness that hopefully will stay throughout their lives and help set them up for some healthy dietary patterns throughout their lives. And I think that's it. That is. Thank you.
So this isn't the end of the discussion, it's the start of the discussion. I want to thank our panelists very much for the excellent presentations. I hope you join us.